wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. Got some really good news. Came out on November the 10th. Robert F. Kennedy Jr., who is the Secretary of Health and Human Services, and Marty Makary, who is the FDA Commissioner, held a news conference saying that they were taking the black box warning labels off the hormones, female hormones. In 2001 and 2002, the Women's Health Initiative was done, and at that time, due to some improper data, the FDA declared that hormone replacement therapy for postmenopausal women was not indicated and that it came with a host of risks. And what was evaluated at that time were the hormones that women were using. They were using Premarin, which is horse estrogen. It's not natural bioidentical human estrogen, and Provera, which is a counterfeit progesterone. As you would recall, in a woman's menstrual cycle, in the first, right immediately after a woman has her menstrual period, she begins to make estrogen hormones. Estrogen hormones proliferate the inner lining of the womb. Mid-cycle, a woman would ovulate and give off the egg. And in that area of the ovary, it's called the corpus luteum, she begins to make progesterone, which matures the inner lining of the womb. As women march through their menstrual life, starting at puberty all the way up to menopause, which occurs on an average at about 50 years of age, the hormones begin to fluctuate after childbirth and then into the late 30s and 40s, and they begin to have lower levels of production of progesterone, and that can lead to dysfunctional uterine bleeding. And then the hormones eventually stop, both the estrogen and progesterone, and women have menopausal symptoms. And for those of you that have gone through that, you know, that's the hot flashes, and that's the night sweats, and the mood swings, and depression, and a host of other symptomatology that goes along with losing your hormones. And remember, the hormones are very important for the function of your cells to feel youthful and young and normal. And so doctors historically have given Premarin, which is horse estrogen, and Provera, which is counterfeit progesterone, and it was given in the form of Prem-Pro, and some of you women may remember that. Well, that was taken completely off the market due to the Women's Health Initiative. But now those studies have been reevaluated by the FDA, and the FDA Commissioner, Dr. Marty Makary, has removed the black box label warnings that these can cause significant health problems, which they found statistically weren't correct. Now, when we found out about the Women's Health Initiative, we were already using bioidentical hormones, and it only made sense to us to use natural bioidentical hormones that were identical to the hormones women made, and we've used that since 1996 in our practice here at the Hotze Health and Wellness Center with great success and with no increased incidence of any health problems. As a matter of fact, it dramatically improved women's menopausal symptoms. It helped them feel normal again. So this was good news that the FDA came out now with removing the black box warning label to say that hormone therapy for menopausal, even premenopausal women, is safe and can be effective in relieving those menopausal symptoms, which are the hot flashes and the night sweats. It improves bone density. It improves cardiovascular health and cognitive function. Remember, the hormones play a significant role in the way we produce our neurotransmitters and the way we think and feel, both in females and in males. So males go through andropause, their male hormones decline, And that can lead to a host of health problems, cognitive dysfunction, depression, lack of energy, loss of muscle mass and tone, loss of focus, attention, mood swings, lack of drive and focus in their work. And as I mentioned, it decreases muscle tone, muscle mass, cardiovascular function, and romantic moods and abilities. So in males, hormone replacement therapy in the form of testosterone can be very effective. And in females, using natural bioidentical hormones, both estrogen, natural bioidentical estrogen, and progesterone has been shown in our practice, and having treated at least somewhere in the order of 25,000 women and 10,000 males, we found that hormone replacement therapy can dramatically improve the quality of an individual's life as they mature and enter the golden years of their life, so they can maintain their vitality, their energy level, and their enthusiasm for life. So this was really a very important proclamation given by the FDA that really exonerated the use of natural hormones, and even, they said, the conventional counterfeit hormones used by the drug companies, although we recommend, if you're going to put hormones back in your body, put the same identical hormones in your body that your body made in adequate amounts when you were younger so you can be rejuvenated. I hope this helps give you confidence on the use of natural bioidentical hormones, and we're here at the Hotze Health and Wellness Center. And if you're interested in gaining increased energy level, vitality, and enthusiasm, don't hesitate to give us a call. I'm Dr. Hotze. Thank you.
At Physicians Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.